Courtney, how did you get started in stop loss?
So after I left the hospital, I worked for a small regional broker. I did some med review for them, sent some RFPs out, things like that. So I actually kind of fell in love with the stop loss industry, and Partners was one of the people that I worked with, and I fell in love with the people that work here. So that's actually what drew me here.
What did you like, or what do you like about stop loss? What drew you to it once you were exposed?
I think just being able to identify people that would need a little extra help as far as their insurance coverage goes, knowing that they're going to predict, in a sense, how much they're going to cost, and we can account for those things. I think that it helps the strain on healthcare and on the industry as a whole if you can predict for them and plan for them.
My favorite thing about my job at Partners is the company and the people, and that's being totally honest. After working in healthcare for over 20 years, to be outside of a medical setting has been wonderful and a really nice shift for me at this point in my life.
I was thrilled to be a part of the team when I got on. I think they're always trying to do the right thing for their clients.
What has been the most surprising thing that you've learned in your time at stop loss?
That's a great question. Actually, I think that the most surprising thing I've learned is how much things actually cost. Being on the healthcare side as an ER nurse, we never looked at insurances, we never looked at cost of something. We just treated the patient, and whatever they needed, you gave them. So I think that's been really interesting for me to see on the other side, is how much things actually cost and how hard it is for. I always knew it was hard for patients to get the care. I didn't really understand why it was hard for them to get the care.
I agree with what Courtney said. The cost of the care is much higher than I ever anticipated. I think I always kind of had it in the back of my mind when I worked, and you're being reminded, taking care of patients, to be, use things efficiently and appropriately and not waste things. And now I totally understand why. And it's disappointing that it's that difficult for patients and families to get the care that they need, and still have to worry about how they're going to pay for it in the end.